Welcome to today's video. We're talking about the barriers to better mental health in the older Asian community and, more importantly, how to overcome them. As many people age, challenges like memory loss, physical health issues, and emotional stress naturally increase. But for older Asian adults, these struggles are often hidden. Cultural stigma, language barriers, financial pressures, and limited access to care all make it harder for them to seek help. At the same time, society as a whole is aging. By 2040, millions more Asian Americans will be over 65, placing greater strain on families and caregivers. The question is, how do we support them? One big factor is culture. Research shows that depression rates in older Asian adults appear lower than in other groups. But this doesn't mean they're not struggling. Instead, symptoms are often expressed differently, more through physical complaints than emotional words. Add stigma on top of that, and many cases simply go unrecognized. Interestingly, studies of schizophrenia show that outcomes in developing countries can actually be better than in wealthier ones. Why? Because strong family and community support play a powerful role in recovery. This shows us that social structures matter just as much as medical treatment. When it comes to dementia, the risks rise sharply with age. By 85, about 1 in 3 people may have some form of cognitive decline. What makes this especially difficult is that dementia often comes with behavioral changes like agitation or paranoia. In many Asian families, stigma delays diagnosis, and caregiving usually falls on women. This leads to extreme caregiver stress that often goes unnoticed. Managing dementia isn't just about medication. Many behavioral changes come from treatable medical problems like infections or even constipation. That's why it's critical to investigate the cause before assuming it's just part of dementia. And while medication can help, it must be used cautiously in older adults to avoid serious side effects. Personalized, non-drug approaches, like meaningful daily activities, often make the biggest difference. There are also protective practices worth highlighting. Tai Chi and yoga have been shown to boost thinking skills, reduce anxiety, and improve mood, even for people already experiencing memory decline. And traditional intergenerational living, common in Asian households, brings its own benefits. Elders provide emotional support and wisdom, while children gain academic and social advantages. Finally, the biggest step forward is breaking down stigma. Using respectful language, creating culturally sensitive resources, and recognizing the diversity within Asian communities are all essential. By doing this, we can open the door to earlier diagnosis, better treatment, and healthier families. So the takeaway is simple: supporting older Asian adults with mental health challenges requires not just medical care, but also cultural awareness, family support, and community resources. When these come together, real progress is possible.